hands and put gloves on. Hi, my name is Peyton. I'm going to be the nurse practitioner student performing your abdominal assessment today. First, I'm just going to inspect your abdomen. I do note that it is symmetrical. I do note that it is flat in contour. There's no rounding. I do note that the umbilicus is not inflamed or bulging. I don't notice any masses, lesions, or rashes while looking at the skin. I don't notice any peristasis or aortic pulsations also. Next, I'm going to move on to osculation of your abdomen. I'm going to listen in all four quadrants, starting in the midclavicular line, and I'm going to note frequency and character. I do note bowel sounds in all four quadrants. They are normal in sound. They're not hypo or hyperactive. Next, I'm going to listen to your arteries, starting with the aortic, moving to the renal, iliac, and femoral. I do note +2 pulses in all arteries. Next, I'm going to listen to the liver and spleen for any friction rubs. No friction rubs noted. Next, I'm going to move on to percussion. First, I'm just going to percuss your abdomen for general dullness and tympanic. And I'm going to note dullness where the liver is and tympanic where the spleen is. I'm going to percuss in all 9 quadrants. Dullness is noted over there on the right side where the liver is. Next, I'm going to percuss your liver. I'm going to start at the midclavicular line coming downwards until I hear dullness. Dullness noted. And now I'll come upward in the midclavicular line from the umbilicus until I hear dullness. Dullness noted. And now I'll measure. And your liver span is about 4 inches. Next, I'm going to percuss your spleen for splenomegaly. I'm going to come down the axillary line and note tympanic. If I hear dullness, then I would be concerned for splenomegaly. And that is tympanic. Next, I'm going to move on to palpation. I'm going to palpate in all 9 quadrants. Just let me know if there's any pain.
No pain.
Okay. I'm going to have you bend your knees for me. And I'm going to perform deeper palpation. Let me know if there's any pain.
No pain.
And if there was pain, I would perform rebound tenderness to be concerned for peritoneal inflammation. This would be pressing down and releasing upward and see if the pain is worse when I release. Also, if I noted any masses, I would, while palpating, if I noted any masses, I would note their shape, their location, their size, their diameter, their mobility. And now I will move on to, keep your knees up please, move on to palpating your liver. So I'm just going to come down from the 11th to 12th rib cage and palpate in an upward and downward motion. And you just take a deep breath for me. Any pain?
No.
Next, I'm going to palpate your spleen. I'm going to come, I would come across with my left hand along the border of your spleen, and I would palpate upward to try to find the edge of the spleen, even though this can be difficult. Any pain?
No.
Okay. Next, I'm going to palpate your kidneys, so I'm just going to have you lay on your side for me. I'm going to put one hand on your front side, and I'm going to palpate the kidneys. Is there any pain here?
Nope.
Any pain here?
Nope.
Okay. And while I'm back here, I will perform a specialized test called the CVA. I'm going to come to the CVA joint. I'm going to put one hand on it, and I'm just going to fist pump it. Any pain?
Nope.
Okay. You can lay on your back for me. Next, I'll just have you put your hands on your side. I'm going to test your aortic width. So I'm going to come from the midclavicular line. And I'm just going to put my fingers around the aortic width. And I'm going to measure that, and it's about 3 centimeters. Next, I'm going to perform some more specialized tests. I'm going to look for ascites. So I'm just going to percuss your liver, moving in a lateral direction. I'll have you lay on your side for me, the side facing me. And I'm going to percuss again. And I'm going to feel for any fluid shift. No fluid shift noted. I'll have you lay on your side for me.
The other side?
Or back, sorry. Next, I'm going to test for appendicitis. So I'm going to feel on your left side here, and let me know if you feel pain over there on your right side.
No.
Okay? Put this one leg down. Next, I'm going to have you lift this leg up, and I'm going to put pressure above your knee and just try to resist, and let me know if there's any pain here in your right.
No.
Okay? And if you lay on your side here. Next, I'm going to bend this knee at a 90-degree angle, and I'm just going to have you cough for me while I bring your knee external outwards. Is there any pain?
No.
Okay, good. So that was the roasting was the first test, the SOSA was the second test, and the obturator was the third test, and there's no concern for appendicitis. So you can lay on your back for me. And the last thing, I'm just going to put your hands at your side. And you take a deep breath for me again, and I'm just going to test for cholecystitis. So I'm going to press on your gallbladder. Any pain?
Nope.
And I'm going to test for a spleen rupture and just press on your spleen.